Right, let's talk about the time when the NHS gave 3,000 of its patients HIV. Yes, you heard it. Yes, the NHS. Back in the 1970s, there was a big scandal about the NHS where they needed blood products for its patients. Certain of their patients had haemophilia. Haemophilia is a disease where the patient's blood doesn't clot because they do not produce any platelets. So off the NHS went to seek for blood products. Yeah, so they went to the USA and looked for people that wanted to donate blood. The only thing is that they went to people that were living on the streets to get blood from them. Yes. So this is actually unethical, and also it's an economic problem. So what they wanted to do is probably cut cost, I think. And so they went to the people that would probably ask for the least amount of money and wanted money quick, which were people that were living on the street. So trams, street workers, pimps, you can imagine, right? I'm going to read a news article, and here it is in the Metro. Can you see? Yeah. Right, okay. So it's 40 years of bloody cover-up. A damning report has finally revealed how the infected blood scandal that killed 3,000 people and ruined the lives of many more could have been avoided and was hidden for decades in a subtle, pervasive and chilling cover-up. NHS, do better. I particularly remember this story because my mum told me about it. I wasn't alive when this scandal happened, but she did tell me that she would not want any of her children to have a blood transfusion. For this reason, she said, you cannot clean blood. When you think about it, it's quite true, isn't it? How can you clean blood? She said the only way that you can clean blood is if you boil it, and when you boil it, it's no use to anyone. Anyway, yes. So this was a big scandal, and finally the patients and their relatives have finally received some compensation. It's probably not even a lot because it is the UK and they're a bit tight with those type of things. But however, at least they've recognised it and tried to resolve it in some kind of way. I'm also going to look at, a lot of people want to reform the NHS, and I'm just going to look at some reasons as to why. Okay, a lot of the time people complain that there's 3-hour wait for ambulances. 26% of A&E patients wait more than 4 hours to seek medical treatment and help. Wow. Waiting lists are up by 200%. That is in 2024. It's up by 200%, so even higher than it was previously, and it's always had a backlog. Terrible. You've got 23,000 people waiting on the waiting list for more than 2 years. That's for treatments such as hip replacements, knee replacements, and things of that sort. We've also, in the UK, we have the highest rate of obesity in Western Europe. We have the lowest cancer survival rates of any Western or developed nation. Consistently below average treatment. We are 17th out of 19 at treating curable diseases. Infant mortality is at 27% higher than Western Europe. And we have a 3-hour wait for ambulances. With all that being said, sounds like a lot of negatives, but here's some positives. Right, the NHS ranks the highest in healthcare equality. Right, so what this actually means is, among its strengths, the NHS does better than a lot of other health systems. And what that means is that it's at protecting people from heavy financial costs. So when they have a problem, an ailment, or a health concern, they're less likely to ignore the problem and seek a doctor because they know that they do not have to pay money up front to get treatment. Yeah, because we all pay with our national insurance contributions and taxes in this country. Yeah, everything that we pay for, that we always complain that our taxes are very high. Yeah, NHS. Right. So, there are some positives to the NHS, but there definitely needs to have some type of, refinement, or even some services might have to be put into the private sector. Yeah, some private and then some national. Yeah. Also, I do think, like, they should have other services in different places, like pediatricians, they should be out somewhere in the community. Yeah, pediatricians, we have podiatrists that are out, and chiropodists that are out into the private sector, and some in the national sector. But yeah, I think a lot of more of the services need to be privatized, probably. I mean, not all of it, just a few, and keep the rest of the NHS national. Yeah, as we do. All right then, thank you for listening, and I'll be back with some more things on health news, health, anything to do with health, yeah? Because this channel is going to be about health news, sport, nutrition, exercise, skincare, vitamins, herbs, hair care, anything like holistic health. I look at health, mind, body and soul, not just eating or nutrition. Okay. And it will also be woman focused. Yeah, woman focused, and woman centered. Yeah, because I'm a woman, okay? So it's easy for me to relate and understand with other women. That's all, folks. All right now.